Thursday, September 24th, in the year of our Lord, 2020, I sat down with David Choules, who is my neighbor and cousin, to discuss a problem that many state and local governments have made worse by addressing it inappropriately. I, Warren Rogers, am a candidate of the Independent American Party for Utah State Senate, District 24. The game that you see me playing, while you listen to Brother Choules and I talk, is not related to what we are talking about. The game keeps your eyes busy while your ears do their civic duty. The game is called Favor Chess. If you wish to try Favor Chess, Steam.com offers a free download. Okay, for this game, notice I have turned the sound volume down. That's to make sure that you can more easily hear my voice and Brother Choules' voice. This affects the music and the sound effects of the game.
I believe the media and the Democrats are working to make COVID-19 more of a disaster than it really is.
So by that, do you mean that it's not really as lethal as they pretend?
Okay, I believe people are dying from it, but not the numbers that they say.
So they say right now we're up to about 200,000 in the U.S.
Okay.
Do you think it's less than that?
Yes.
Or why would their number be off?
Because the federal government is paying hospitals to list deaths as COVID deaths, so they're listing all deaths as COVID deaths in hospitals.
Because the federal government helps with COVID, but not with other things, the hospital has an incentive to pretend that everything is COVID.
Yes.
Yeah, that's a problem.
The head of the CDC said that the vaccine won't be any better than masks. They shut down New Zealand. They shut the whole country down when COVID hit. And everybody obeyed. If that happened in the United States, you'd have major riots. People feel that they got the right to their freedom to do what they want to do. And that's one of the problems that I don't know how to get around.
But I've also heard that these lockdowns really haven't shown that they can reduce the COVID infections or deaths very much. Because in states like Florida that did much less lockdown than a state with similar population, New York, they've got about the same amount of deaths. But people didn't get economically devastated because they didn't do lockdowns.
I understand. That's one of the reasons why I don't think the lockdowns are helping.
So as far as the policy response of our state government here in Utah, sounds like you're not in favor of lockdowns.
No, I'm not.
What would you favor?
That's hard.
Well, while you're thinking for a second, let me comment. I think that these lockdowns have been disastrous. Because I hear, for example, in the news that 1 out of every 3 renters in the U.S. can't make their rent payments now. This was a way to make a health problem into an economic disaster on top of it. Very bad idea. What do you think about a mask mandate? Do you think that's a good idea for COVID?
No.
Why not?
The particles for the COVID virus are so small that a mask won't stop them. During the Black Death, the people wore masks. And the idea behind the masks they wore is they're trying to scare the Black Death away from them. And I believe our masks work as good as theirs did.
So what you're saying is the lockdowns really don't help much and the masks really don't help much. So what do you think would help?
I do believe one thing that helps is having people not traveling between different cities, carriers not carrying it to different parts of the country.
That could slow it from coming to a certain area.
But if it's already there, then what do? I believe if it's going to happen, it's going to happen. If COVID's going to kill me, it's going to kill me.
When they first started talking about COVID-19 and what our response would be, they talked about slowing the spread. But that's all it ever really was. Ideas for slowing the spread. It was still going to spread. Everybody would get it eventually. But if they slowed it down, that way we wouldn't have so many people sick all at once that it would overwhelm our medical system.
The second wave of COVID has started. I read about that in the Deseret News this morning. The second wave has already hit most of the United States. Okay, I should tell you that there are at least 3 different types of vaccine they're talking about making for the COVID virus. And I don't know when any of these are going to come out. The best date I've got is next April. And one of my problems is I don't like the idea of having the COVID virus politicalized. They're using the COVID to destroy Trump.
What I will have to say about COVID-19, though, is we need to handle this problem well, This is going to be here for a while. So any mistakes that we make is a mistake that we're going to be living with for a long time. Like I say, the lockdowns, very, very dangerous, harmful idea. It's caused a lot of damage to people's economic well-being. Now we got people faced with homelessness and so on. The masks, it's very debated how effective they really are. So a mask mandate probably won't help that much, but it is a key reduction in our freedom.
I believe that the masks can help and they will make people feel better, but one of your problems is requiring everybody to wear them. The singing teachers in Delta High School, she can't sing wearing a mask, and I've got no problem with her taking it off while she teaches her singing class. She's not within 6 foot of her students anyway. She's far enough distance from them that I don't think it should bother her taking off her mask while she teaches. It's like people are working with the deaf and dumb. They don't have to wear a mask because the deaf and dumb have to be able to see their lips to figure out what they're saying.
What you're talking about now is an excellent illustration of the idea that any kind of a general mandate with masks or with other things will not work in certain situations. With the deaf and then the dumb you're talking about, they can't communicate, wear the mask because the lip reading doesn't work. So there's a reason why somebody needs an exception. And with any kind of mandate, whether it be with masks or with lockdowns, you have the same problem. Somebody needs an exception. And if the authority that issues these mandates doesn't realize that beforehand, they will cause a big problem.
We need to have uniform rules and uniform standards so everybody knows what's expected of them.
Well, how is the authority at the state level or even at the federal going to know what those uniform rules should be?
The people on the bottom, like the people in Delta School, they know who can't wear the mask and who can. So the people at the top who are making these rules need to talk to the people who are going to be having to abide by them, find out what will and what won't work. Bush's No Child Left Behind, that was a terrible disaster. And all the teachers I talked to thought it was terrible. That's because it came from the top and the bottom people had nothing to say about it. And they were the ones that had to enforce it. And basically it was something that was done to get votes, like most things in politics.
Well, that's a very valid point. Politicians do things to get votes, regardless of whether it's really a good idea to do that thing.
When Brother Choules and I had the preceding discussion, we had no script and we did not rehearse. The recording you just heard was the first take, but I did edit the recording to shorten it, to keep the discussion on topic, and to help both Brother Choules and myself to sound better by eliminating tongue-tied moments, etc. What I say in this discussion is my stand on the issues covered. I oppose any statewide lockdown, or mask mandate for the public. You are citizens, not medical professionals like the character shown. You do not rightfully have his duties. As for what Brother Choules says, I support his right to state his own opinion regardless of whether I agree with his opinion or not. I thank all those who are working to protect public health, including citizens who take actions appropriate to their circumstances to protect their own health and that of those around them. Please use your imagination to put appropriate social distance between the citizens in this collage. Do you know who the remaining candidates for Utah governor are as of October 2020? Do you know what each of them stands for? If not, is it time for some research? Yes. Most offices are low profile compared to President of the United States, or even Governor of our state. If you did not know the candidates for governor, do you think that your fellow citizens know the candidates for Utah State Senate? For most offices, the most important reason why your fellow citizens, your peers, vote for the wrong candidate or not vote at all is that they do not know who the candidates are or what the candidates stand for. A candidate who stands for the right normally has less money for advertising because special interest groups that want unfair privileges do not contribute to his campaign as they contribute to more conventional candidates. Your peers, your fellow citizens need your help to learn what the media will not tell them. Will you please like, share, and subscribe? I will put a link in the description below this video. Please send it to each person you know and recommend that he watch this video. The link points to my YouTube channel where a citizen can find all my videos until YouTube censors them. Furthermore, I do want to discuss important principles and issues with my fellow citizens. Will you please leave your comments below this video? If the number of comments is manageable, I will respond to each of them, in some cases with a video about a topic suggested in a comment.